curious, what's the link between the orthopedist and your menopause patients?
So in perimenopause, they have an increased incidence of
Hip
frozen
bones.
shoulder and carpal
Okay.
tunnel. And I actually wasn't even aware of that until I started studying it. He was basically saying those folks have been like sent all over town to get better and they're not getting better. And then they come to him and there's like a 10-minute procedure in his office and they're going to work like perfectly fine, half an hour
Sure.
later.
Sure.
So,
Wow.
yeah.
Interesting.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here.
Well, hello, hello, hello. Hi again, everyone. Welcome, welcome, welcome to the Care Room with Dr. Cindy. I have another episode ready for you today. And I know I say this every time, and I know I say this every time on every episode, but I have another very, very special doctor with me. Her name is Dr. Nadia Sirdar, and she is joining us today from Bethesda, Maryland, where she has her own direct primary care practice. Yes, guys. So we've talked about what a direct primary care practice is, but she's here today to kind of, shed some more light on that for us. And maybe you will hear it if you hear it from a different perspective, it'll make more sense to you guys. So, but before I kind of butcher everything and, mess things up, I'm going to let her introduce herself.
That's so kind of you. Thank you so much for having me, Cindy. I appreciate it.
Yeah,
My name's
absolutely.
Nadia Sirdar. I'm internal medicine trained physician, worked for the last decade in hospital medicine and saw a lot of very complicated sick patients and really came up to a point in my career where I thought, I could keep doing this for a long time or I can sort of pivot. And so I really am passionate about prevention and partnership. My background is in public health. So direct primary care is like a perfect sort of union of prevention and primary care and public health and sort of serving my community. And so that's my goal. That's what I'm trying to build.
Absolutely. Well, thank you for your service and thank you
Yeah.
on behalf of your patients in that area. Thank you for what you do. But Dr. Nadia, can you explain to us what is a direct primary care practice?
Sure. So direct primary care is a membership based model. So what that means is that you pay for the year or semi-annual or quarterly, and it includes your annual exam with an EKG, if it's appropriate, and a well women's exam. So your standard pap smear and well women's, and 5 additional visits, as well as direct access to me, your doctor.
Okay.
And the real sort of like advantage of this way is that all the noise, all the insurance companies telling us what we can and cannot do, administrative staff that I need to process insurance claims to be able to do all the business side of it, all that's taken out of the picture. And so essentially it's me, my patients, and then my staff is a nurse manager and a practice manager, and that's it. And so when you call, you're going to hear my voice or my nurse manager's voice. And if I'm seeing a patient, I literally get to like pick up the phone and talk to you within like an hour or so. So it's pretty different because it's very intimate. It's very sort of familiar, and really the goal is to kind of have a medical home. So whatever comes up, there's no like, can you tell her to say this to so and so, and are they going to call me back? And maybe they will, maybe they won't. And if there's a problem, I'm going to get you in the same day, right? So that's the
Right.
point. Is like we save all the drama because we're going to get you in when you need us, right?
Right.
It's a little bit more, it's more affordable. It's direct. There's not like a lot of extra people involved. And then we don't take insurance, but we do this new law that came out starts in January 2026. I don't know if you know about it, but for those who have health savings accounts, they can spend up to $150 a month on their direct primary care. So I think for us, it would come to like the patient would pay like $50 out of pocket, which is, I think, less than most gym memberships.
Yeah. And from my experience, like there are different, even within a direct primary care model, there are different models, right? So like, yeah, okay.
Absolutely.
So you
Yeah, so,
described
like,
yours.
everyone can set right, everyone sets their own kind of rates and their own sort of what's included, because I think it has a lot to do with your bandwidth, where you are in terms of high cost of living or lower. I think a lot of physicians may be more or less comfortable with procedures or, different states have different rules about if you can give medications from your office. So some doctors can incorporate, like, dispensing medications. For Maryland, that's much more complicated, so we don't do that. And then, of course, as I scale up, I'm hoping to offer labs in house, but right now it's just me. So I'm kind of like doing something in between. But the idea is, I think, if you've seen one DPC, you've seen one DPC, right? So it really is going to give the doctor the freedom to create a space for themselves that's going to be the best for them to practice and the best for their patients.
Sure. And that makes sense. Yeah. So in getting to know you, you mentioned that you were a hospitalist for like 10 years. What was the straw that broke the camel's back and made you decide to leave hospital medicine and start your own direct primary care practice?
Yeah, that's a really good question. So it wasn't actually one specific thing. I think I got really lucky and I worked with amazing people. And I think the hardest part about leaving was leaving them, because I think you do get this camaraderie and you're kind of in the
Right.
trenches together and you just feel like it's like a family. You see each other more than you see your real family. So, and we're kind of going through the same season in life together, like so and so is pregnant, so and so is having their baby. And so that
Right.
part was hard for me. And I felt a little bit like, am I being a traitor? Giving up on them? Am I leaving my team? Like, it's weird. You feel very like strongly loyal towards the people you spend so much time
Sure.
with. So there wasn't any specific event. I think for me, it was, I have three children, 12, 10, and 5-year-old is turning 6 today. And
Yes.
it's so wonderful. Happy birthday, Omar.
Yes.
But I think the biggest thing to me was they're growing really fast. I feel like 5 minutes ago, my seventh grader was in kindergarten and now she's in
Yeah.
seventh grade. And am I able to be present on my days off? And I was so fatigued on my days off that it was taking me a bunch of days to catch up and be functional after I had been on for 5, 6 days straight. So it was really like the work became more and more demanding emotionally and physically. And then I also think that as we get older, our pace changes and our priorities change. And I kind of
Right.
thought, do I see myself doing this for 20 plus years? I consider myself hardcore. I could probably like power through, but I sort of was like,
That's sad that we do this to ourselves. Like,
we're like, let's just power through. But I was like, I don't want to power through my life. I want to be happy
exactly.
and satisfied and fulfilled. And plus, I felt like the kind of medicine I wanted to practice was just not possible in the context of hospital medicine, because you're in for a critically ill issue. You're fixing what's there right in front of you, but you're not really curing, right? I mean, heart failure, you get them out of the heart failure, but they still have heart failure.
Right.
End stage cancer, anything that people are coming into the hospital for, they're just getting much sicker. And so that satisfaction of quote unquote helping, yes, you're helping them, of course you are. But just that feeling of did I affect real change? I think that was what was really the impetus for me to say, I'm going to try this.
Okay. Got it. Got it. Well, thank you for doing that. And from what you've said, what I've gathered is it makes you a better doctor because you're having more of a balance to your life.
Yeah. I don't know about the
Yeah.
balance just yet because I've never worked so hard in my life.
It's coming. It's coming. We made the changes to try to get that balance.
I just did recess for Omar for his birthday because
See?
they don't. I was telling you they don't do the class parties anymore.
Yes.
So they said you can come and volunteer for recess. So I stuck in there my sweatpants, and then I was like, I have to get to Cindy. So I rushed back. I put on makeup. I put on a nice top. And my husband's like laughing at me because I'm pounding down the stairs like half dressed.
I know, right? See? See, but you were able
So
to make it on his birthday.
that's the thing. I would
And it's
never for 20 minutes of recess in a hospital shift. No way. And
no
you
way.
feel
No way.
completely ridiculous asking somebody to cover you for 20, 30 minutes, right? So
No
I would
way.
just miss it. I wouldn't even consider.
Exactly. Exactly. Happy
Yeah.
birthday, Omar. By the
Happy
way,
birthday!
your mommy gave you a huge shout out. So we love it. We love it. But yes, and we all know that when a doctor is happy and, at peace, because you can't give from an empty cup, right?
That's exactly
So
right.
your doctor needs to be happy and at peace and, rested, to be a great doctor. So I'm so glad that direct primary care, it affords us, that ability to do that for sure.
Cindy, oh, sorry, go ahead.
No, 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 go
No,
ahead.
I was just going to say the other thing that's really like kind of interesting to me is we were talking about kind of which patients are attracted to us.
Right,
And I really, when I first started, I'm taking care of men and women equally, and they're sort of very sort of diverse in terms of their medical backgrounds, but men and women are equally coming into the practice, which I think is wonderful. And I'm so grateful for that. But it's interesting because I also have an older population, and it's the folks that are like the Medicare age group. And, I've opted out of Medicare. So it's a little scary, but then they'll say to me, I'm not getting the care I thought I was going to get. And I keep going back to the hospital. No one's giving me the story, or I don't know why I'm back at the hospital every
right,
third month. So it's interesting to me because, you go out building your practice thinking it's going to look like one thing, but really it defines you as much as you define it, you know?
right.
And I think keeping that open mind, and in that vein, I have a special interest in perimenopause and menopause. And so there's a lot of women who look like me, like just saying at book club or whatever, like PTA events, like, I can't believe how spaced out I am, or I can't believe how, and so I've started studying for that, and I have a special focus for that. And it seems to be like working. It seems like a nice fit.
That's awesome. That is awesome. And that's the beauty of having, the flexibility based on your interests and the need of your community to
That's right.
do different things. So tell us more about the perimenopause, menopause
Absolutely.
focus of your practice. What does that look like?
I think it's gotten like a lot of wonderful coverage lately. Like, I think there's a lot of wonderful physicians that are in like the social media space that are really bringing attention to something that's so important. But I think what happens is that in the general medical population, most of our colleagues are not comfortable still with prescribing HRT or even having a conversation about it, simply because we were trained in such a way that, with the Women's Health Initiative, we just kind of got this really negative type of messaging that was like, it's dangerous, it can cause all these problems. And everyone in the medical world knows about that. But it's like, even if you have that data dispelled, the actual comfort of practicing medicine differently, it's not there. And I think a lot of our colleagues are working so hard and seeing so many patients. Who has time to stop and do an exam on the side, or like
I
read
know.
extra stuff or do a course? So I think that there's a huge gap in care. And so I'm getting a lot of patients who have bread and butter primary care issues like overweight or high blood pressure or diabetes. But then they're like, and also, by the way, I have all these other symptoms, and like, can you help me? Because so and so said they didn't feel comfortable. And so I was like, well, thank goodness they said they don't feel comfortable and you can have the freedom to come to me. But I'm also thinking like, wow, that's not great. Like, we need to get on the bandwagon and help each other. And really, like, I make a point to reach out to all my specialist colleagues and say like, hey, ear, nose, throat, like, hey, orthopedics, like, what are you seeing in this population, right? So that you can serve them in like a more complete way.
And that's, oh my gosh, you are hitting the nail right on the head. So how does that work with a direct primary care practice? Is that covered, the specialist?
So no, like, when you keep your commercial insurance or your catastrophic insurance for catastrophic events, right? So for most people with commercial insurance, they use that for their labs and imaging, hospitalizations, and specialists. But what's really nice is that I have developed slowly but surely like a network of physicians that are just like when you make friends, you find like birds of a feather. So there's people that are more interested in taking care of this population. So for example, I met through one of these Montgomery Medical Society type things, an orthopedist who is the expert for carpal tunnel and frozen shoulder, and all the peri and menopausal women in my area go to him. And I would never
Wow.
have met him if I didn't say, like, I'm so excited about menopause. And he's like, me too. So, I mean, he's somebody that I can definitely refer to. And in fact, a couple patients had issues that I just called them. And he's like, actually, they don't need to see me. You can do A, B, C for them. And if all that stuff comes back positive or negative, this is how I would proceed. So
Mm,
I can do the workup. I can help my patients. They don't have to go to every other person.
right.
But if they need a procedure, for sure, I have somebody to send them to.
Sure, sure. Oh my gosh, that's so awesome. I'm curious, what's the link between the orthopedist and your menopause patients?
So in perimenopause, they have an increased sort of, I should say, incidence of frozen
Midlife.
shoulder and carpal
Okay.
tunnel.
Okay.
And I actually wasn't even aware of that until I started studying it. And then a lot of
Okay.
people will tell them, like, go get PT, go do this, go do that. And nothing really helps them. And so, really, it's his, I can't remember what exact procedure he was telling me he does. Forgive me, I don't remember the procedure. But he was basically saying those folks have been like sent all over town to get better and they're not getting better. And then they come to him and there's like a 10-minute procedure in his office. And they're going to work like perfectly fine, half an hour
Sure.
later.
Sure.
So,
Wow.
yeah,
Interesting.
yeah,
Interesting. Yeah. Well, thank you for sharing that. So, yeah, so direct primary care, all
yes,
right, versus insurance.
yes.
And you mentioned that if you're having the direct primary care, if you're a member of a direct primary care practice, you do recommend the catastrophic insurance.
Yeah, because I think the most important thing, I mean, I think right now people are seeing their ACAs with the ACA rates, like I think the cost is going up like 20-25% for some families. So I think this is a really good hybrid where you can take care of your family, but have backup in case, God forbid, like you're crossing the street and something
Right.
catastrophic happens, right? But the idea is that we're going to save people from going to urgent care and getting piecemeal care. We keep everybody well and you're taking care of everyone's needs in one spot. So you're not getting that like extra cost, right? Because if you think about it, the average urgent care visit is what? 150, $300. And then you go back 3, 4 times with the flu, with a, RSV, whatever it is that you're getting from your kids from school, and so by the time everything's said and done, you probably spent a couple $1,000s in that year. So
Yeah.
wouldn't it be better to like prevent all of that,
Yeah.
be in a good place, like
It makes
physically?
sense. Like,
Yeah.
it makes
Right.
sense. I think the message just needs to get out there more. And we really have to kind of keep talking and educate and educate
Yeah.
and educate.
I think so. I mean, I also think there's this important sort of messaging for a lot of the women and like, we're all so busy taking care of everyone else and we're taking care of like our kids and our parents and working hard at our jobs. And so I think that whole like self-care thing becomes like a luxury, but it doesn't have to be a luxury. It
Yeah.
should be
Yeah.
like, what you were saying, like pour from a full cup, not an empty one. Put on your
Right.
oxygen first. But it's
Right.
like very popular to say that, but to actually physically do that is
Mhm.
really hard.
Exactly.
Because you're like, who am I to spend extra money on myself? That's silly. But just remember you're investing in yourself because the whole point is
Exactly.
to not be sort of completely run down in 10, 20 years.
Exactly.
Yeah.
Exactly. Oh my gosh, this is so good. So so our audience is busy moms. So if there's a busy mom listening, what would be the thing that you tell her she would get the most from with
Like
a
the
direct
3 tests
primary?
that she shouldn't miss or like the 3 so you should make sure. Because 'cause I've actually thought about this, like, I was actually before I was talking to you, somebody was asking me yesterday, like, "What do you see the most of?" And
Yeah.
it's the lowest hanging fruit, and it's gonna sound so silly, but there's 3 things. 1, the lipid panel,
Okay.
and LP little a, which is to screen you for high cholesterol because that's
Sure.
really the beginning process for getting atherosclerosis and cardiac risk and coronary artery disease. I mean, that seems like such a like common, easy thing to fix, but a lot of people don't do their lipids. It's fasting lipids once a day, once a year. And the A1C to screen you for diabetes. That's like your average blood sugar for the last 3 months. And then the third one, which is shocking to me, is how many people are walking around with high blood pressure.
No.
Blood pressure is a big one because they call it the silent killer because people don't have symptoms until it's the very end. I had this beautiful, active, fit physician patient yesterday, and I had to check her blood pressure twice because she's young. She has no reason to have high blood pressure, and it was like 20 points above normal. And we did it on both arms. And she's like about to cry. And I'm like, wait, we're going to go home. We're going to get a new cuff. We're going to calibrate this and talk about it in a week. But my point is, she's not somebody I would look at and think, oh, she doesn't
Right.
have
Right.
medical information. She's a physician. She
Right.
knows.
Right.
So those 3 things: A1C, blood pressure, lipid panel.
Sure. Sure. Oh my God. Thank you, Dr. Nadia. So this is so, so, so important. Can you tell us if someone is listening, they love what they heard, they want to find you in Bethesda, Maryland.
Yes,
How
ma'am.
can they find you?
So they can find me on BethesdaDoctor.com. I'm super excited about that website. Can't believe I got it. So Bethesda Doctor, DOCTOR.com. And then I have an Instagram at Dr. Nadia Sirdar. And I have Facebook and YouTube and TikTok. But honestly, I'm mostly on Instagram and Facebook just because that's
Okay.
like what I know and it's easy.
Sure.
And some of my younger cousins were like, "You have to be on TikTok. That's the way to like get out there." And I'm like, "I'm not going to be singing and dancing for anyone,
Exactly.
but I'm happy to educate. So if that's a space that I can educate, I'm happy to do that."
Sure. Well, thank you. Thank you for
Thank
gracing us with your
you.
time on the care room
No, I
today.
appreciate that.
Yeah, we are so appreciative. We wish you the
Thank you.
best with your practice. We know it's going to be great and fabulous, just like you are.
Oh, I appreciate
Your
that.
patients are so, so fortunate to have you as their doctor.
Well, thank you.
And it has truly been, truly been our pleasure
Thank you
having you
so
here.
much, Cindy. I appreciate it.
You are very welcome. Yeah. But guys, as always, if you need Dr. Nadia's information, it will be in the show notes. Definitely check her out. And again, next week we will have another awesome doctor with us. But until then, take care.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always consult your personalized healthcare provider for medical guidance.